Sleep is not a luxury. For seniors, it is a medical necessity. Yet one of the most common complaints I hear is this: "Doctor, I wake up again and again at night just to use the bathroom." This condition, often dismissed as normal aging, slowly steals deep sleep, energy, balance, memory, and independence. Tonight, I want to share senior secrets, simple, science-backed insights, and 5 safe exercises that can help reduce nighttime urination and restore healthier sleep. Nighttime urination is often brushed aside as a normal part of aging, but medically, it is far more important than most people realize. Waking up multiple times at night to use the bathroom is not just a minor disruption. It is a clear signal from the body that something is out of balance. When sleep is repeatedly interrupted, the body loses access to its deepest and most restorative stages of rest. Over time, this leads to chronic fatigue, reduced concentration, slower reaction time, and emotional stress. For seniors, the consequences are even more serious, as poor sleep directly increases the risk of falls, memory decline, and weakened immune function. From a clinical perspective, frequent nighttime urination places strain on the heart, kidneys, and nervous system. Each awakening causes a spike in blood pressure and heart rate, preventing the body from fully recovering during the night. In individuals managing diabetes or hypertension, this repeated disruption can worsen overall disease control. What many do not realize is that the bladder is often reacting to issues elsewhere in the body, such as fluid retention in the legs, weakened pelvic muscles, poor circulation, or an overactive stress response. Another overlooked concern is safety. Seniors who wake frequently at night are at a higher risk of slipping or losing balance in low lighting, leading to fractures and long recovery periods. This creates fear, reduced mobility, and loss of independence. Nighttime urination also affects emotional well-being, contributing to frustration, anxiety, and feelings of helplessness. The most important message is this: nighttime urination should never be ignored or accepted without attention. It is a health signal that deserves understanding and care. When addressed early through lifestyle adjustments, movement, and targeted exercises, it is often possible to reduce symptoms, protect sleep quality, and support long-term health without immediately relying on medication. Aging is commonly associated with bladder problems, but medically, the bladder is rarely the only system involved. What truly changes with age is muscle strength, coordination, and circulation. The muscles that support the bladder control urine release and maintain posture gradually weaken over time, especially when daily movement decreases. Long periods of sitting, reduced physical activity, and loss of muscle tone all contribute to this process. As these support structures weaken, the bladder becomes more sensitive, leading to urgency in nighttime awakenings. With age, the pelvic floor muscles lose elasticity and responsiveness. These muscles act like a supportive hammock for the bladder. When they weaken, even small amounts of urine can trigger the urge to empty the bladder, particularly at night, when the nervous system is more reactive. At the same time, core muscles and hip stabilizers also decline, reducing overall control and stability. This creates a chain reaction where the bladder appears to be the problem, but the root cause lies in weakened muscular support. Circulation also changes with age. Reduced blood flow and fluid movement cause fluid to pool in the legs during the day. When a person lies down at night, that fluid shifts back into circulation and is filtered by the kidneys, increasing urine production. This is a mechanical process, not a bladder defect. Muscles play a critical role in pumping fluid efficiently, and when they are inactive or weak, nighttime urination increases. The encouraging truth is that muscles respond to training at any age. Even gentle, low-impact movements can restore strength, improve circulation, and enhance bladder support. When seniors understand that muscle health is central to bladder control, they gain back a sense of control and hope. Addressing muscle changes rather than blaming the bladder alone opens the door to safer, more effective solutions for better sleep and long-term well-being. Pelvic floor exercises and deep breathing are often underestimated, yet they play a powerful role in improving bladder control and reducing nighttime urination. The pelvic floor muscles are responsible for supporting the bladder and regulating the release of urine. With age, these muscles tend to weaken, making it harder to hold urine during periods of rest. Strengthening them helps the bladder remain stable throughout the night, reducing unnecessary signals that wake the body from sleep. These exercises do not require special equipment, standing, or strenuous effort, making them safe and accessible for seniors at all mobility levels. Deep breathing works alongside pelvic floor strengthening by calming the nervous system. Many nighttime bathroom trips are not caused by a full bladder, but by an overactive stress response. Shallow breathing keeps the body in a heightened state of alert even during sleep. Slow, controlled breathing activates the parasympathetic nervous system, which signals the body to relax and rest. When the body is calm, bladder sensitivity decreases and urgency becomes easier to control. When pelvic floor contractions are paired with deep breathing, the benefits multiply. Coordinated breathing improves muscle awareness and control, allowing seniors to engage the correct muscles without strain. This combination also improves oxygen flow, circulation, and mental relaxation before bedtime. Practicing these exercises in the evening helps the body transition into a sleep-ready state, making nighttime awakenings less frequent. Consistency is more important than intensity. A few minutes each day can gradually restore muscle tone and nervous system balance. Over time, seniors often notice fewer urgent urges, longer periods of uninterrupted sleep, and improved confidence in bladder control. These simple exercises quietly retrain the body, offering a natural and effective way to support better sleep and overall health without medication. Leg elevation and ankle pump exercises address one of the most overlooked causes of nighttime urination in seniors. Fluid redistribution. During the day, gravity pulls fluid downward. It's causing it to collect in the lower legs and feet, especially in individuals who sit or stand for long periods. This fluid does not disappear. When the body lies down at night, it returns to circulation and is processed by the kidneys, increasing urine production and triggering frequent bathroom trips. This process is mechanical, not a failure of the bladder, and it can be improved with simple movement. Leg elevation in the late afternoon or early evening allows excess fluid to move back into circulation before bedtime. Raising the legs above heart level for a short period encourages natural drainage and reduces the amount of fluid that shifts during sleep. This small habit can significantly reduce nighttime urination when practiced consistently. It also helps decrease swelling, improves comfort, and supports better circulation in aging blood vessels. Ankle pumps further enhance this effect by activating the calf muscles, which function as a natural pump for blood and lymphatic fluid. Gentle flexing and pointing of the feet stimulates circulation without strain. This movement is particularly beneficial for seniors with limited mobility, joint stiffness, or balance concerns. Ankle pumps can be done while seated, lying down, or during leg elevation, making them easy to incorporate into daily routines. Together, leg elevation and ankle pumps reduce fluid buildup, ease pressure on the bladder at night, and support overall vascular health. These exercises work quietly and efficiently, often producing noticeable improvements within weeks. By helping the body manage fluid earlier in the day, they allow the bladder to rest at night, leading to fewer awakenings, improved sleep quality, and greater daytime energy. Core and hip stability movements play a crucial role in bladder control, balance, and nighttime comfort, yet they are often neglected in senior health routines. The core muscles, including the deep abdominal and lower back muscles, work together with the hips to support posture and internal organs. As these muscles weaken with age, the bladder loses structural support, increasing pressure and sensitivity, especially when lying down. This lack of stability can trigger urgency and contribute to repeated nighttime awakenings. Weak hip muscles also affect pelvic alignment. When the hips are unstable, the pelvis tilts out of its optimal position, placing strain on the bladder and pelvic floor. This imbalance can make it harder to fully control urine flow and can amplify the sensation of needing to urinate. Even when the bladder is not full, gentle core tightening and hip stabilization movements help restore proper alignment and improve muscle coordination, reducing unnecessary bladder signals during the night. These exercises do not require standing or complex movements. Simple seated or lying down core engagement, combined with slow hip opening and closing motions, can activate key support muscles safely. When performed regularly, these movements improve circulation, enhance nerve signaling, and increase overall body awareness. Improved stability also reduces the risk of nighttime falls by enhancing balance and control during sudden movements. Another important benefit is confidence. When seniors feel stronger and more stable, anxiety around nighttime movement decreases. Reduced fear leads to better relaxation, which further supports bladder control and deeper sleep. Over time, consistent core and hip stability exercises contribute to fewer nighttime interruptions, improved posture, and greater independence. Strengthening these foundational muscles supports not only bladder health but also long-term mobility, safety, and quality of life. Many seniors believe that meaningful health improvements require intense effort or strenuous exercise. But medically, the opposite is often true. The body responds best to gentle, repeated signals rather than occasional bursts of intensity. Consistency allows muscles, nerves, and circulation to adapt gradually and safely. When exercises are performed regularly, even for a few minutes each day, they retrain the body's systems to function more efficiently. This steady approach is especially important for bladder control and sleep quality, where subtle improvements accumulate over time. Irregular exercise creates confusion in the nervous system. Performing movements only once in a while does not provide the repetition needed for lasting change. Daily or near-daily practice builds muscle memory, improves coordination, strengthens the communication between the brain and the bladder. This is how urgency decreases and nighttime awakenings become less frequent. The goal is not to exhaust the body, but to guide it gently back toward balance. Consistency also reduces the risk of injury. High-intensity movements can strain joints, increase pain, and discourage long-term participation, particularly in seniors with arthritis or limited mobility. Simple, controlled exercises done at the same time each day become part of a routine, making them easier to maintain. When exercises are linked to daily habits, such as morning routines or evening relaxation, adherence improves naturally. Perhaps the most powerful effect of consistency is confidence. Seeing gradual progress reinforces motivation and reduces frustration. Better sleep leads to better energy, improved mood, and clearer thinking during the day. Over weeks and months, these small, repeated actions create meaningful change. Health improves not through force, but through patience and persistence. When seniors embrace consistency over intensity, they unlock sustainable results that support long-term independence, safety, and well-being. As we come to the end of this video, it's important to remember one simple truth. Waking up at night to urinate is not something seniors should quietly accept as normal aging. It is a signal from the body, and when that signal is understood and addressed correctly, real improvement is possible. Better sleep is not out of reach, and it does not always require medication or drastic changes. Often, it begins with small, intentional movements and a deeper awareness of how the body works. The exercises discussed are not complicated, aggressive, or time-consuming. They are designed to work with the aging body, not against it. Pelvic floor activation, deep breathing, leg elevation, ankle pumps, and gentle core and hip stability movements encourage balance, circulation, and control. Together, they support the bladder, calm the nervous system, and help the body release excess fluid earlier in the day, allowing the night to be what it is meant to be, a time for rest and recovery. What truly makes the difference is consistency. These movements become powerful when they are practiced regularly, even for just a few minutes a day. Over time, many seniors notice fewer nighttime interruptions, deeper sleep, improved energy, and greater confidence in their bodies. Better sleep leads to better balance, sharper focus, and a stronger sense of independence. Aging does not mean surrendering comfort, dignity, or quality of life. With the right knowledge and gentle daily action, the body can adapt and improve. Restful sleep is a foundation of health. Protecting it is one of the most important investments seniors can make in their overall well-being.